Lifekare Hospital, Amritsar. Dr. Arpit Singh, Additional Professor, King's George Medical College. All right, we'll start again. Good evening, ladies and gentlemen. I'm Simran Kaur from Voice of Healthcare, and I welcome you all to a virtual panel discussion on World Osteoporosis Day, Uniting for Stronger Bones, organized by Voice of Healthcare and powered by Zydus. We welcome our esteemed guests, Dr. Nipun Rana, Associate Consultant, Sir Gangaram Hospital, Delhi, Dr. Sudhir Seth, Senior Consultant, Orthopedics, Fortis C. Doc, Delhi, Dr. Rajesh Kumar, Consultant Orthopedics, Lifekare Hospital, Amritsar. Dr. Arpit Singh, Additional Professor, King's George Medical College, Uttar Pradesh. Dr. Ashish Gupta, Advanced Orthopedics and Joint Replacement, Charak Hospital, Lucknow. Dr. Rajiv Gupta, Senior Consultant Orthopedics, CK Birla Hospital. I welcome you all. So just to start with the session, Dr. Nipun, I would want to ask you, for the general audience, could you just explain in simple terms about what osteoporosis is and what are some of the signs of the condition?
Osteoporosis, as we all are orthopedic surgeons who are sitting here, and I think it's for the general public to know that osteoporosis is increase in the porosity of the bone. In simple words, the hardness of the bone gives way. So our bones, since our childhood, are made stronger, are well woven bones. They are like a honeycomb, like just a madhu. So there are those bones. If the porosity within those bones increases, the hardness of the bones goes away, and they become more porous in nature. Then we call it osteoporosis. So the strength of these bones, the signs which we will see in patients, they'll present to us can be of different varying age groups, and most commonly we see females who will be coming in the age group after the age of menopause, and equally men can be also equally involved, as it is a age-related problem as well. So such patients will be presenting with fragile bones and having pain in the bones, and presenting with maybe minor fractures in the wrist, hip, or the spine region. Some patients may also complain of having chronic low back ache with decrease in their height or a stoop kind of nature of their spine, which is a very gradual process. So these minor signs, some patient might be asymptomatic as well, and we are supposed to really judge them on the basis of their daily routine habits, what they have. So these are the signs and symptoms which patients can really present with, and most commonly the spine is most commonly involved. Apart from that, the disease is basically present can be present in young patients as well. So it is not just the elderly who are getting affected because of this problem. In younger population, because of various causes like patients who are taking steroids or having rheumatoid arthritis, or patients who are having hyperthyroidism or parathyroidism, patients on some chronic medications like anti-seizure drugs, or even chronic heparin intake. So such patients can also get involved and can have osteoporosis. So these are also some of the some family history and medication history are supposed to take from patients as important signs and symptoms for diagnosing osteoporosis.
Thank you, Doctor.
Yeah.
Moving on, Dr. Sudhir, I would want to ask you if somebody is concerned about osteoporosis, what are some of the steps that they should be taking after getting diagnosed?
The diagnosis is basically one should the physician who is treating the talking to the patient and examining the patient should have a high index of suspicion. The most important thing is while taking history, if the patient is presenting with say is presenting with a backache or maybe even having a fracture or having lethargy or difficulty in moving around, the the diagnosis of osteoporosis should be in the mind of the physician, and then only you can have leading questions in the history taking, which will can lead you to the diagnosis of osteoporosis. But then there are confirmatory tests thereafter. So if a person, suppose I got a patient who is 40, 44 plus, he is having similar problems with backache or moving around stores. Then and the person is suppose having a history of diabetes or hypothyroidism, then my mind should be telling me that with this person is osteo can be osteoporotic, especially if the person is uncontrolled diabetic or if the person uh, is of a such a social economic strata or if the person is indulging in uh, alcohol or smoking. So the mind should be knowing that this person can be having osteoporosis. Then only you can confirm it by tests. So high index of suspicion should be there in the mind of the physician, and the, and thereafter you can confirm it with tests. The most important gold standard test is the dual X-ray absorptiometry, which is also known as DEXA scan. DEXA scan is a thing which is recognized by WHO, which has a statistical thing known as T score. So if they say the T score is less than equal to minus 1.25, then it is a sure shot that this person is having a osteoporosis. But if the person is having a T score between minus 1 and minus 2.5, the person is on the verge of osteoporosis, which is also known as osteopenia. But if the person is in the positive or above minus 1, the person is labeled as normal. So this is one of the final tests which is ordered by all of us to to finally label the person as osteoporotic. But before this, sometimes in for mass screening, we can even use the lower limb based heel scanning, which is ultrasound based. So this test is sometimes used in our busy OPDs or in health camps. Start a conversation. Like if the person is having a very low score on this heel scan, then a person can be ordered for a DEXA scan. And besides the gold standard DEXA scan, one should also see after taking history, order the complete uh, blood tests and urine tests. The most important, like you have to be a very thorough clinician. You should look in between the blood tests, read in between the lines. So even a plain, suppose the person comes with a uh, old blood report, which is just showing a CBC. If a person is anemic, and if the person is having a high CRP or a high ESR, so there is a high inflammatory markers are there. This person can again be a candidate for osteoporosis because it has been seen if a person is having a low hemoglobin or low B12, then this and patient is anemic. This person will be having other deficiencies which can lead to osteoporosis. So again, a high index of suspicion should be there in the mind of the patient, and the doctor can order further tests. So, but once we are in the lookout for this, so there should be no stopping back. One should ask for a complete blood count. One should get a, a complete KFT, kidney function test, renal function test, the liver function test, thyroid function test, and complete calcium, phosphorus, and vitamin D levels, intact PTH, and we can even order for homocysteine because the persons again I'm talking about the socioeconomic the nowadays in the society there is a lot of prevalence of alcoholism and smoking. So these patients can be having high uh, this, homocysteine levels, and these homocysteine levels again are a known risk factors for causing osteoporosis. So if we are hell bent upon treating the osteoporosis, everything should be A1. The HbA1c is another thing. Normally patients are asked how's your sugar, जैसे कि fasting postprandial तो मेरी ठीक आती है, PP इतनी है, fasting इतनी है, या PP मैंने कराई नहीं. तो in order for HbA1c, it has been seen that HbA1c is not controlled or if insulin levels are high. So these patients, the bone turnover and the bone repair process, bone metabolism takes a ebb, especially in patients who are already having comorbidities like diabetes or patients who are on anticonvulsant medicines. The certain you should take a thorough history. If the person is having a history of taking anticonvulsants or antidepressants, and person is supposed to suffering from trigeminal neuralgia, so many patients of ours are having multiple medications given by different physicians. So these medications again can bring down the calcium metabolism and can cause osteoporosis. So everything should be looked into. And if the person has been started on or is being started on proper treatment, then their bone turnover markers like CTX, which is also known as C-telopeptide cross-linked peptides, they should be taken care of so as to have a baseline of the degradation markers. So once we are building the bones, we should know are our medicines are effective or not. And if we are giving anabolic, one should get a PINP markers also at the sort of treatment. So we should have a complete gamut of investigations done to diagnose and to properly monitor the treatment, osteoporosis treatment.
Thank you for the insights, doctor. Moving on, Dr. Rajesh, my question is to you. Many people worry about osteoporosis as they age. So, could you provide some guidance on the lifestyle choices and some of the preventive measures that individuals can adopt to avoid such a condition? Doctor, you're on mute. Doctor, you are on mute.
Sorry. Good evening, everyone. Now, can you hear me?
Yes, doctor.
Yeah. Good evening, everyone, and congratulations to have this webinar on osteoporosis because this is a more negligent disease now, especially in the urban peoples. To, as you asked, to prevent this osteoporosis, the most important thing is to diagnose it at early age. So if you can diagnose, if you can see the on-risk patient, you can prevent this osteoporosis to occur. But lifestyle changes, if you want to know, one has to take a good diet, have a good physical activity so that bone should be bearing a good weight. Activity around 40, 25, 40 minutes, 25 to 40 minutes a day can lead to good deposition of bone in the bones, good deposition of calcium in the bone, which later on can delay this osteoporosis thing, which usually occur after some age, after 50 years in females and 60 years in male, when they have less hormones and the osteoblastic activity which decreases with the age and the osteoclastic activity which goes on leads to this osteoporosis. So the best thing is to have a maximum amount of calcium in the bone right from the early age. So for that you should have calcium rich diet plus the physical activity which is very much important. Plus patient should be aware about his medication, about his diseases which lead to osteoporosis in later age because this occurs in years. Okay, so if one starts on the early age of adulthood, one should take good diet, do regular physical activity for 20-25 minutes a day. One could prevent these things. As we grow older, bone has to go weaker, but we can delay those things. The weakening of the bone, which occurs in 10, 12, 20 years, can be delayed to 20, 40 years with proper intake of supplements, proper intake of diets, proper activity, knowing your diseases, knowing the risk factor you are involved to cause this osteoporosis. One should be aware of these things. That is the only way to prevent it.
Thank you so much, Doctor. Moving on to Dr. Arpit, my question is to you. Osteoporosis isn't only a concern of the elderly, and can you share some information on how young adults and even children can take steps to protect their bone health?
Good evening, everyone. So it's a very good question. And actually, prevention of osteoporosis in young is just similar to an SIP. As soon as you start it, it is as better. And some of the things that we can advise to a patient to have delay the onset or to decrease the effect of osteoporosis is first and the foremost is nutrition. A good diet, a good calcium and vitamin D rich diet will help in prevention of osteoporosis. Then second most important thing is physical activity. We are seeing these days after the COVID era, more and more children are more addicted to the gamings and mobile phone and TV, laptops and all these things. And there has a declining trend of physical activity and physical sports. So promoting good physical activity and especially weight bearing exercises like walking, running, and all the strength in training, it will help in building the bone mass and it will help in preventing osteoporosis. Then third thing is quitting smoking and alcohol, or you can say if not quitting, then at least decrease it. So it can also go a long way in prevention of osteoporosis. Then limitation of this soda and caffeine rich diet. The paper are showing that the people who are taking a lot of soda and caffeine, they have more chances of having osteoporosis. Then one thing is maintaining a good body weight, a healthy body weight, I mean. So maintaining a healthy body weight is very important for prevention, or that decreases the risk of osteoporosis basically. Adequate protein diet, it also help in decreasing the osteoporosis. A proper sunlight exposure. In today's world, we are less and less going in direct sun. So it is usually recommended that approximately 20-30 minutes of sunlight is good for our vitamin D levels, and it will help in prevention of osteoporosis. Then limitation of very high salty diets. It also helps in prevention of osteoporosis. And then this is stress management. Stress management is also important in these words. We are seeing a lot of kids, a lot of young adults now are in a great stress. So prevention of stress also has been seen as a great step in prevention of osteoporosis. So by all this, and last but not the least, any symptoms of any, if any, there is concern regarding the bone or there is some symptoms, then you should seek an advice early to a medical practitioner. So that will also help in prevention of osteoporosis. Thank you.
Thank you, Doctor. So many of us are curious about the non-medical interventions for osteoporosis. What role does diet and exercise play in maintaining strong bones, Dr. Ashish?
Well, when we are talking about treatment of osteoporosis, first we must differentiate between a patient who is having established osteoporosis, like someone who is having a BMD, a T-score of minus 2.5, and someone who is at risk of developing osteoporosis. Because when we are talking about a patient who is having a T-score of minus 2.5, he has had some fragility fracture. There is no substitute of a pharmacological therapy. He has to take anti-osteoporotic medication. There is no substitute for that. Because if you will not take anti-osteoporotic medication with a low BMD, established osteoporosis, bone mass will not increase. Then there is a second subset of patients who are at risk of osteoporosis, or they want to prevent osteoporosis. So there may be so many repetitions of things because Dr. Arpit said about so many dietary modifications. So you have to take a diet which is rich in calcium and vitamin D. And in our Indian perspective, the most important thing is dairy and dairy products. So you have to take milk products, curd, paneer, cheese. these are the rich source of calcium. Many of our patients are intolerant to milk. They are having lactose intolerance, so milk will not be a very good option for them. So they can switch over to curd and paneer and cheese. Other than that, you can have fish, which is also a good source. Green vegetables are also a good source of calcium, but nothing is better than having dairy products. You also have to have good vitamin D intake. The source which is in abundance is sunlight. Many of us are not taking that because we Indians are so much obsessed with fairer skins that we don't want to go expose ourselves to sunlight. And there was an interesting study which was conducted by ICMR, which showed that almost 80% of the urban population is vitamin D deficient in India. And one of the strategies they propose that this vitamin D deficiency should not be there was mandatory fortification of the food. So now and in coming future, we are going to see fortificated with food with vitamin D. Meat helps, not too much. Then there are certain things which you have to avoid, like alcohol. If you want to consume alcohol, that should be in moderation. Alcohol in large quantities are going to affect your bone badly. Caffeine intake is also going to interfere the absorption of calcium, so this should not be. This should also be done in moderation. Same thing is with coffee and tea. Soft drinks has been a bit controversial. Like as such, carbonated drinks doesn't interfere much in calcium metabolism, but cola does. So even if you want to have soft drinks, better to avoid it. If you want to have, please have non-cola. Apart from these nutritional aspect, exercise this do help. Exercises are important. They maintain your bone mass, preserve the bone architecture. So, in long run, if you exercise daily, you are going to have a stronger bone, and those bones, those are not susceptible to fractures. Live a healthy lifestyle. Again, as conveyed by so many speakers here, do regular exercise, have a good meal, rich in vitamin D and calcium, and a healthy lifestyle, a stress-free lifestyle, and that is only going to help. But again, I would like to emphasize, if you are having established osteoporosis, then you have to undergo anti-osteoporotic treatment for that, and that too is for sufficient time. That will be 3 to 5 years. I hope I made myself clear.
Yes, doctor, thank you. And you spoke about the treatments that are available. Dr. Rajiv, I would want to understand the treatments that are available in depth, all of the treatments for osteoporosis. Doctor, you are on mute. Yes. Doctor, we can't hear you. Doctor, I believe there's some technical issue at your end. We'll move to the next question. So, Dr. Nipun, I would like to ask you if you could explain various treatment options for osteoporosis, both medical and lifestyle based, in depth. Over to you, doctor.
Yeah, hi. So the medical management and there's a lifestyle management. I think the lifestyle management has been talked a lot by most of the speakers here, by Dr. Ashish, by Dr. Arpit. The lifestyle management, as we all know, includes exercises, especially weight-bearing exercises like brisk walking, mild jogging, if possible. One should not overexceed their limits and should not exert their body or develop a fracture by doing a lot of exercise at the same time. And dietary inputs has been already talked about various items like in vegetarian like milk products like curd, cottage cheese, and non-vegetarian things like salmon, fish, maybe a part of mutton as well. So these things will help in improving your calcium and vitamin D levels. And uh, and and lastly, the most important thing, the natural source of vitamin D is sunlight. The exposure to sunlight is equally important by most of us, whether it be children or the adults as well. So lifestyle has to be healthy, stress-free, enjoyable, and with all the good items going inside our stomach. Coming to the medical management will include obviously the chemicals which make up the structure of our body, the bones. So we have minerals which make up the body. We have the proteinaceous material called the collagen which make up the bone, and there are certain cells which help in promoting bone production, or either they help in resorbing the bones. So we should understand the bone as made up of three structures: the proteins, calcium, which is the mineral part, and thirdly, the various kind of body cells. So minerals we get from our dietary intake, and also the medical part we can say that as the calcium tablets. And calcium comes in various forms, like calcium citrate and calcium carbonate. Among them, the calcium citrate is preferred one as it creates less of acidity or gastritis as compared to the other ones. For absorption of calcium, we require vitamin D, which also has a dietary requirement. And if one has a deficiency of vitamin D, one has to go for a vitamin D intake. So deficiency of vitamin D should be established before actually saying that a person has vitamin D deficiency. In our country, we have most of the doctors, we have a habit of giving vitamin D without getting the blood test done, or just by saying that person has osteoporosis. A simple X-ray just gives us an idea whether the person has osteopenia or osteoporosis, but getting a levels done is always a good idea. And as one of the speakers also told, that 80% of the Indian population has vitamin D deficiency. So it is a very rampant problem which everyone has. But does this low vitamin D level actually affects every individual clinically, symptomatically? It's very difficult to assess. So coming to the level of vitamin D, I would say that 20 nanograms per ml is the limit. If it is less than that, or maybe one can take 30 as a limit. Less than 30, one should always supplement vitamin D levels. And it can be supplemented by giving either a single shot injection of 6 lakh international unit, or giving a 60,000 international unit vitamin D in various forms of availability every twice a week for at least 5 to 6 weeks. So vitamin D is another medical management. For vitamin D to really act efficiently, magnesium and zinc are equally important, which should be also given along with them. So once you have a calcium levels are normal, once you have attained a normal calcium blood level by giving a supplements of calcium, magnesium, zinc, and vitamin D, so now you have your reserves maintained. So this is the first thing you have to maintain. You have to achieve in your medical management. Once they are normal, you are supposed to see whether your kidney functions are running normal or not for that particular person, because the further medication we shall be giving to treat osteoporosis may have effect on our kidney as well. So if the kidney function is pretty okay, then we can go for medications like our either drugs which will prevent osteoporosis, which will prevent the bone resorption, or we can give drugs which will actually help in formation of bones. That is the way the drugs which help in formation of bones are called anabolic drugs, whereas the drugs which will prevent bone resorption, we have a certain class of drugs which help in preventing bone resorption, and we have bisphosphonates in them. Such patients where the kidney functions are pretty okay, we should try to give these two classes of drugs. In case we have doubt about the kidney function, or we have doubt about patients having severe gastritis because of our medications, esophageal stricture, esophageal achalasia, and varices, one can always go for medications which will be non-bisphosphonates or non-anabolic therapies. Such drugs are the newer kind of drugs. We have the monoclonal antibodies or denosumab, and they are the another line of drug which we can give. So there is also option for IV drugs, like the bisphosphonates can also come in form of IV as zoledronic acid. So medical line of management has to be started on the basis of our diagnosis, which can be done in our country as a screening, even based on a simple X-ray of a spine or the hip, or a patient who is having diagnosed case of fracture, fragility fracture of wrist, hip, or the spine. We need not do a bone mineral density in all cases if patient is already suffering from a fracture. In only at-risk patient who are at risk of developing osteoporosis, or where we want to diagnose osteoporosis, we should get a BMD done, and based on the T-score, we are supposed to manage the treatment medically. I think over to you, Simran.
Thank you so much, Doctor. Moving on to Dr. Sudhir, can you talk about some of the common medications that are used to treat the condition, and what are some of the benefits and also side effects of these medicines?
Many of the speakers have talked about at length about the diet things. I want to reiterate that before starting the medication, after getting the diagnosis made, because it should be in the right earnest. The patient, if you give a documentary evidence to the patient, you are having this disease, then the patients are more convinced and they stick on to the treatment, because the most important thing about the treatment is that most of the patients, they stop the treatment in between. They take the treatment for 2-3 months at the maximum, they leave in between, and then the losers are the patients, and they come back to you with another fragility fracture. So you have to give a document to them, because if you come across the patients, even the patients are not taking vitamin D. Most of them, they understand the vitamin D is a course. कि हमने 2 महीने का course ले लिया, हो गया काम. Then there is a misconception कि one should take for 2 months, then you stop for 2 months, you take for 3 months, or stop for 6 months. So several school of thoughts are existing, and even our general practitioners, they make the patient understand कि ज़्यादा calcium लेने से stone बन जाते हैं. So calcium is something which is abundant in diet. The thing which is absorbed, the calcium can be absorbed from the diet only if vitamin D is there. The vitamin D is very important for absorption and for the utilization of the calcium in the gut and in the blood. So if the vitamin D is supposed to be the key to open the lock of the calcium availability. So again and again we have to reiterate, though it's abundant sources sunshine, but we are starved of sunshine. We are wearing full sleeve clothes throughout the year to prevent a mosquito bite. So practically, even if we are in the sun, we don't get sunshine. So best is to, I tell my patients, a medicine worth 10 rupees per month is what you need to take if you are not taking anything. So again, I want to reiterate, a good diet, abstinence from alcohol, and somebody was saying about cola. I say all fizz drinks or anything having fizz should be stopped. Beer, alcohol, and any colas or any soft drinks. Anything having fizz chelates the calcium from the bones, and because the calcium carbonate in the and the carbonated drinks, it pull out the calcium from the bones. So there is a big no to carbonated drinks. So most of the things which are available uh, are labeled as junk foods. The patient should be they should be told with the younger generation of which is coming like the first and second decade. Most of them are addicted to pizzas, burgers, and chips. So all these things they eat into our absorption capacities, and they don't allow the calcium and vitamin D to be absorbed. So, and third important thing is the exercise. So daily exercise of 45 minutes. They should tell their children or themselves. Everybody should go out and either in the gym or maybe outside, and they should do exercises. And most important thing is to work out every muscles. 630 muscles are there. They should even work on the upper limbs. So weight training, strength training exercise are very important. So the most important exercise is uh, walking, cheap and best. But besides this, jumping or skipping is another cheap exercise. Or simply going up and down on the stairs for young people is anti-gravity exercises to build the bones. And then once the calcium and vitamin D and intake is enough, then we can tell our patients how to take vitamin D. Vitamin D is the most important thing as I retreated. So somebody told about 20 micrograms, 20 nanograms is bare minimal, 30 is sufficient, and but we should not be hovering around 30. As I tell my patient, you should not be aiming about pass marks. If 49% is the pass mark, we should be getting 51%. We should be aiming for uh, vitamin D level of around 50 to 60. So even if we skip, it should not drop down to 40. Especially in people who are obese, especially in people who are having comorbidities like diabetes or who are on anticonvulsants and are hypothyroid. So most of the people at that age of senior citizens, they're having some comorbidity. So why not keep your vitamin D close to 50, 60, 70? The toxicity levels are said to be above 100, but nobody, if you touch 100 also, nobody throws the toxic symptoms. So one should can take safely 60,000 IUs of vitamin D every week. And most of us tend to forget, so it comes down to twice in a month or fortnightly. So that is the benchmark. So how to reach that level of 50, 60? The best is either to give a loading dose of vitamin D, as somebody pointed out, parenteral. The other way of certain people are afraid of injections. If I used to suggest injection, कि अच्छा अच्छा डॉक्टर हम कल ले लेंगे, आज नहीं, आज empty stomach है, आज नहीं खाया. So this is the excuse, and once you don't, the patient doesn't take, it's left for the patients. Many of patients who come to us, they have their reports. कि डॉक्टर हम तो रिपोर्ट कराते हैं. If you go through the reports, they are having vitamin D deficiency, which was diagnosed 6 months back, and nobody looked into it. So this is the basic tragedy with the patients. कि reports तो हम कराते हैं, उसको कोई देखता नहीं है. That is another I think pathetic thing. So best is the patient is in your chamber to give them. Another way to give vitamin D is to open the ampule and let them drink the ampule of 6 lakhs units. So once you give, the vitamin D gets stored in the liver and the good levels are achieved. And thereafter you can take oral medicines, oral vitamin D once in 15 days. So good diet, good calcium intake, balanced diet. So vitamins are equally important. So what I tell my patient, not to take a pill of vitamin E, a pill of niacin, or pill of this thing. Let them take uh, uh, for things which are nowadays readily available, which contain appropriate minimal amounts of all minerals, vitamins, vitamin E, and which can be taken even alternate day. There's no need of taking, because every season carries its own set of fruits, every set of uh, vegetables. So we can't have all the nutrition all the year round. So I tell my patients कि भाई जामुन तो बरसात के दिनों में आएंगे, तो जामुन का जो वो चीज़ है वो तो उन्हीं दिनों में मिलेगा. तो why not take something which takes care of all the deficiencies instead of getting a test done every fortnightly. So now coming on to the main, once the diagnosis of the osteoporosis is made, then it has to be fought on a war footing. I tell my patients, well, this is a treatable thing and you should do it on a war footing. And most of the patients are postmenopausal or senile, they are genetic patients. So, and many patients, if you take a history, certain people, females, they got a hysterectomy done at the age of 35, 38, and their ovaries, they stop working. So practically they are left with no estrogen. So they develop a premature osteoporosis. So these patients, I tell my patients to build, now you have already lost your vitamin D. Your peak bone mass has never reached. So it is better to act now than to crib about the past. So best is to bone mass now, even at the age of 60, despite all comorbidities, and then carry on with the stock which you have built. So the ongoing process, ongoing war against osteoporosis is a lifelong thing. So there are two set of treatments for osteoporosis. The one is anti-resorptive, as somebody pointed out, and other is the anabolic or bone building. So bone, the stock is just like a bank balance. If you are already uh, depleted of your bank balance, you have to put certain things into your account and then maintain the account. And the best way is
Uh, Moving on to Dr. Rajiv. In addition to medical treatments, what support and guidance should individuals with osteoporosis expect from their healthcare teams? Dr. Rajiv?
there is no audio.
Yes, we can hear you, doctor.
You can hear me, Simran?
Yes, doctor. We can. Yes, doctor. We can hear you. Yes.
Okay, fine. Now, see, looking at my all, first of all, good afternoon to everyone. And as my previous speakers discussed about the best way to prevent or the osteoporosis, we can say osteoporosis is a silent killer. We don't know when or where, how it started and settled down in our body. Once we get the fracture because of mild energy trauma, little bit fall in the bathroom, we get a big fracture. This is how we come to know that we have fragility fracture, we have a severe osteoporosis. Important thing apart from as my previous speaker uh, nicely described about the medical management, we have non-medical non-pharmacological management. Looking at first Dr. Arpit emphasized on walk, at least 45 30 to 45 minutes walk is must. I think it is a one of the best way to prevent to avoid osteoporosis, because most of the time osteoporosis we see in older age patients. They have some spine problem, they have some knee problem. We can't think of that they do some aggressive exercise. I think a walk is the best way to avoid injury in other part of the body. The walk is important. It's all depend upon if you don't have in habit, you can start gradually. What is the advantage of walking? Walking makes our muscles stronger, make perfect helps in balancing, because walk, if we do walk, it gives it gives us proper balancing, and that this is how we can prevent the fall. Because second issue in older age group, what is fall? Most of the time we see fracture because of fall in the bathroom, because of fall while coming down from the stairs. So we have to, I educate my patients that how we can prevent. First of all, we see what type of floor we have. I advise my patient to keep in mind about their slippers. Slippers are very important. And second, one more thing, is there any carpet in your house? Just beware of that, because most of the time slippages happen because of that. I think prevention of fall is another one important thing. We should educate our patients. Bathroom, they keep handrails in their bathrooms to avoid, again, one of the most common reason for fracture around the hip is the fall in the bathroom. I think this is what is required. Third important thing is diet. As we already discussed, diet is important. Avoid carbonated caffeine diet. Keep high protein diets. Keep vegetables, especially palak, tomato. They have good source of they are good source of magnesium. I think these all small steps we can avoid. We can delay the osteoporosis. If our patient is can't go for outdoor activities, I think yoga is one of the way, because what happens if you do the exercise, it keeps the mental health is again in a good shape, because most of the time what we see in older age group, now we have isolated families, older parents are there, so somewhere there is some psychological depression also. I think yoga, outdoor activities, if someone is used to do golf, these all small steps, small sort of exercise, they keep our patients mental level at higher level, and this is important to keep any problem at a bay. That's why the depression and the osteoporosis, somewhere it comes all together. To physical activity first, second diet, of course, yoga. If they have they are habit of indoor activities, they do some light skipping, some impact exercise. I think this is good. And last one is prevention of fall and healthy lifestyle. This is what we can educate our patients to avoid or to delay osteoporosis apart from medical management. Over to Simran.
Thank you so much, doctor. So, lastly, any of the remarks that any one of you would like to add, doctors?
I think we discuss a lot about calcium, but one of the important factors in nutrition that helps in prevention of osteoporosis is the role of micronutrients. So apart from calcium, there are few other minerals also which are also important for the bone health, like phosphorus, vitamin K, and magnesium. So proper dietary intake of all these micronutrients is also important for a healthy bone.
One last from my side. Most important thing is recognize the symptoms, because patient comes to us with ill-defined pain is everywhere, and I think we have investigation, but it is not possible for everyone to get access of DEXA scan, other sort of investigation, though it is important. But on the clinical suspicion, as Dr. Sudhir discussed or briefed about us, we can do on the clinical examination, clinical examination where you doubt suspicious of osteoporosis, for example older age group, diabetic patient, hypothyroid, and it makes sense that this patient might have osteoporosis. And I think recognition of symptoms, we can prevent our patients for any hip fractures, because all we know that if a patient has hip fracture, it's really a burden to families and society. So prevention is always better than cure, but recognition of symptoms and advise and counsel our patient to adhere to that treatment is very important, because there is a lot of, as Dr. Sudhir again डिस्कस अबाउट 2 महीने का कैल्शियम लेना है फिर स्टोन बन जाएगा, इस तरीके के मिथ को वी हैव टू टेक ऑन दिस टाइप ऑफ मिथ एंड एजुकेट आवर पेशेंट्स इन ए better way. Thank you.
Thank you. Dr. Ashish, would you like to add something?
Mute पे.
Hello.
Yes, doctor.
Okay. I'm not
Doctor,
getting
would you like to
voice.
add something? Dr. Ashish? Dr. Nipun, would you like to add something?
Yeah, a small tip of advice for the female patient especially, because it's a very common in female this disease process. So I've seen many patients in our like even developing osteoarthritis of knees, and and as well as osteoporosis, especially post hysterectomy. If they have undergone a hysterectomy procedure, and especially the ovaries have also been removed, it is a very rampant process of osteoporosis and osteoarthritis which develops in them. I think it's a message for all the females out there. Probably the gynecologist also should, guide them properly about the management for their bone strength, especially post such procedures of hysterectomies, wherein we remove the uterus. So that is my take on today's, and I'm very happy World Osteoporosis Day for everyone. I'm having this matha, or do you call it lassi? So I mean, on a Friday, one of our patients he sends us this lassi every time. So it's a source of calcium for me on every Friday.
Yes, doctor. Moving on to Dr. Rajiv.
Yeah. Yeah. As Dr. Nipun said, yes, I think again my message to female patient: please spare time for yourself, because apart from household work, it is very important to do little bit of physical activity in terms of walk, because we
Right.
see hormonal changes, menopause, post hysterectomy, we see lot of osteoporosis, and that's why they have more problem of osteoarthritis, because I think they are associated. And I think I educate my patients to spare time for yourself and go for physical activity. This is must for prevention of osteoporosis. Thank you.
Dr. Rajesh, would you like to add something to this?
Yeah. I think this, as the diseases of old people, most of the time these are old people are dependent on their kids, on their relatives to come to the doctor and to get the treatment. The first thing you should do is on first meeting, you should tell them this disease is going to kill you and you have to treat it. You have to put this in their minds that you yourself has to treat it. So even if they can't afford the most costly medicine, something else, just put them on one tablet weekly or calcium supplements, and just tell them that don't stop them for a year or 2 years. Sometimes you get just one shot and the patient never comes back. Just put in their minds that this is a deadly disease. You can cure it. You do your physical activity and start two tablets, just two tablets, one weekly and one daily, and you be cured. That's my message, that every female after 55 should be screened for osteoporosis.
Thank you, doctor. Moving on to Dr. Sudhir. Your closing remarks, please.
Just like to reiterate one more thing. Like if the patient is having an established osteoporosis, then it has to be cured. The T score has to be built. If we build T score by 1 standard deviation, the fracture is cut by 50%. So that can only be done by injection teriparatide. Injection teriparatide is a wonder drug which is to be given subcutaneously every day, 20 micrograms every day for minimum 6 months to 2 years. And once the bone density is built up, then that bone density has to be maintained by we people and by the patient by taking anti-resorptive medicines for longer time. That can be done by oral medication thereafter, like tablets of alendronate or denosumab. Denosumab is another injection which can be given for 10 years in one go, 6 months, every 6 months. So this is again taken subcutaneously. These two medicines have gone a long way in treating the osteoporosis, because otherwise giving calcium and vitamin D alone in established osteoporosis can't treat osteoporosis. You have to resort to these injections. And there's a myth again in the patients. These people whom we start teriparatide after suppose somebody's got a fracture, we give them for 2-3 months and then they stop taking. It is to be written and retreated. It is to be taken for, if it's established, for at least 2 years, and then followed by anti-resorptive, because the things which cause osteoporosis are going to stay. The diabetes is going to stay. The old age is further increasing. So all those things are to be proactively treated if you want to lead a healthy life thereafter. Thank you.
Thank you, Doctor. Dr. Ashish, would you like to add something?
Sorry, with some technical problem, I was not able to get in between. So, I'd just like to, almost all the things have been discussed by various speakers. Though, few things which I just wanted to add is osteoporosis is something treatment or prevention, whatever you want to say, has to be started from early part of your life. Like most of us, they have their peak bone mass at the age of 35 years. After that, whatever you do, your peak bone mass is not going to increase. So suppose if you are having a higher peak bone mass, then the possibility of getting osteoporosis will be lesser when you get older. So always we should educate population in general to have higher peak bone mass from the beginning. That will come only from the healthy lifestyle where you have to exercise regularly and healthy food where you have to take food which are rich in calcium and vitamin D apart from other vitamins and minerals. So if
Right.
you are going to incorporate these two things in your lifestyle, then the possibility of having osteoporosis in later life will be less. Second thing is when you are having osteoporosis. So while we are worried about osteoporosis, that thing makes you prone to have fractures which otherwise you will not have. You can have a fracture neck of femur by simply missing a step. So when you are having an osteoporosis, apart from the medical management, the focus should be on preventing the falls. So the things which make you prone for the fall, like most of these patients, they will have some issue with their eyesight, like cataract. So if you're not able to see, then you are more prone to fall. They'll have so those then there are things.
There is some issue with the network again, I believe. Thank you so much, Doctor. And with this, we come to an end of this discussion. Thank you for such an insightful session, and you clarified all the questions related to osteoporosis. Thank you so much.
Thank you, everyone.